Well, Health Minister Dr. Zweli Mkhize is expected to outline South Africa's plans to deal with the coronavirus today. And people traveling to China are already very concerned. And we cross now to Chriselda Lewis for more on this particular press briefing that's about to start. It will be in the next 12 minutes or so. So, Chriselda, good morning to you. Please tell us what can we expect the minister to address today?
Well, a very good morning to you, Sakina. At about 7 o'clock this morning, we were expecting the Health Minister, Dr. Zweli Mkhize, together with the World Health Organization and the National Institute for Communicable Diseases, to brief South Africans about the country's state of readiness to monitor, detect and deal with the possible threat of the coronavirus. As we know that the death toll now stands at over 100, but in South Africa, currently, there are no known cases of infection. So I think with the panic that we've seen from some quarters, Sakina, it would only be right for the minister in charge of health to allay fears of South Africans that perhaps all the measures have been put in place to ensure that the borders, for example, ports of entry in South Africa are protected. A few concerns here and there, Sakina, because over the past few days, yesterday, SABC News spoke to a number of South Africans who are living and working in various parts of China. So they're expressing concern about, of course, returning to that country after the Christmas holidays to, a country, of course, which is grappling to deal with the coronavirus. And, we've seen instances where some of those South Africans who we spoke to who are leaving today, have packed things like food and a bit of medication and have also been instructed to bring some masks in order to try and keep themselves safe. One of the key issues or questions that's been raised at this point is about how South Africa is going to protect its ports of entry. One of the key aspects to this, of course, would be the airport, where SABC News understands that there are no extraordinary measures at this point, Sakina, that have been put in place, in addition to the usual scanners that you would find when you're coming from outside South Africa into the country. You would know the scanners that are often put towards your forehead to detect whether you have a high fever or not. So we'll hear from the minister at this stage, together with the World Health Organization and the National Institute for Communicable Diseases, about what extra measures have been put in place. You would know that, Hong Kong, for example, has, limited some of the entry into Hong Kong from mainland China. Is South Africa considering to do that at this stage? Do we see an imminent threat? Those are some of the questions that we'll be posing to the Health Minister. No known cases at this stage of infection, Sakina, but it would be ideal for the Health Minister to allay the fears of South Africans that they have everything under control to monitor and detect. We know we have several flights that come in from different parts of China into South Africa. Are there any extraordinary measures that are being taken currently to ensure that there is extra screening that is done on passengers from those flights? And if there is a case in future that does crop up in South Africa, how are we going to deal with that threat of the coronavirus, Sakina?
Well, Chriselda, indeed, we will be coming back to you just after 7 to actually dip into that press conference live. So we'll leave it there for now.